Now. All right. Maybe it didn't even ask for your permission. Maybe it just went right into the recording. Okay, well, thank you all for being here. My name is Grace Grenager. I'm the public health supervisor, and among the different parts of my role here with the county, one of them is helping to facilitate the Public Health Fund grant making process. So the Public Health Fund, let's see here. I'd have to, So we're going to talk about what the Public Health Fund is, what the process looks like to apply for funding this year. We do have a few slight changes to our process, so I'll make sure that we highlight those for those of you who have maybe applied in the past, so you know what's changed. Most things have not, but we do have a few small tweaks. And then we'll also have time at the end of today's meeting for you all to ask questions. So just want to make sure, do a quick technology check. Is everyone seeing the PowerPoint on their screens? Okay. Looks like technology is our friend today. That's good. Let's try to keep it that way. Okay. So a little bit more about our department. So the mission of our department in Public Health and Human Services is to support the health, safety, and well-being of the community. We got involved with facilitating the grant-making process back in 2018. So prior to that, all requests would just go directly before the county board. But at this point, the board asked for PHHS to take over some of the facilitation of the grant process. So I joined the department in 2019, and I started helping with the grant process that year. So every year we've gotten a little bit better. Every year we've learned something new, but the core has stayed the same. We have an advisory council for our department, the PHHS Advisory Council, and there's a subcommittee of that group that's comprised of 5 very committed community members, some of whom are on the call today. And together I kind of gather all the pieces, and the review subcommittee takes a look at everyone's application. We have a scorecard, and then we come together with funding recommendations that go before the County Board of Commissioners. And ultimately, the County Board is the entity that decides how and whether to allocate funding to the various applicant organizations. So that's in a nutshell what we've got going on. I think I got ahead of myself here. So last year we had $242,436 in requests by local nonprofits. And in the end, we granted out $191,000 to a total of 8 grantees. The range of grant awards was between $12,000 and $50,000 with an average award of $23,875. So that gives a sense of kind of what things have looked like in years past. And later in this presentation, after the PowerPoint is done, I am going to give a little bit of an orientation to our website. That's where you can find more historical information about the Public Health Fund, as well as all of the application materials. Okay, so this year's process, our deadline for receiving applications is June 22nd. So that's coming up here in a couple of weeks. A few things that need to be in place to be considered for a grant award. Your agency must be a 501c3 nonprofit or have a fiscal sponsor that is a 501c3 nonprofit. We've seen that happen with maybe newer initiatives that aren't yet established themselves as a nonprofit, but have some sort of agreement where there's a more established nonprofit that takes on some of the fiscal management of a project. We do require that the primary purpose of your organization is to serve residents of Cook County, Minnesota. And we require that your funding request falls within at least one of our priority areas for the Community Health Improvement Plan. So we're in the process of revisiting that. That's sort of a parallel, separate project for now, for this year, for this grant making cycle. The priorities are the same as they were last year: access to specialty medical services, behavioral health, safe and stable housing, services for elders, services for families with young children, and substance abuse that could be both treatment or prevention. So here's what we've got in terms of our timeline. Back on May 22nd, we released our request for proposals. Here we are on June 6th with the information session. On June 27th, all the applications will be due. This is a piece that's new. In addition to having your written application, we are going to have a short virtual question and answer session with members of the review subcommittee. It's great to get so much information in writing, and that's still the heart of the process, but it is nice. It would be nice, we decided in coming together as a group, to have the opportunity to talk with the agencies that are applying. That way, if there's questions from the group about your application, about the services that your agency provides, about any aspect of the proposal you've put together, rather than having there be like email back and forth, we'll be able to just directly address those in conversation. So I think it'll be really nice. It's not, a huge formal presentation. It really is more of a question and answer opportunity. It'll be about 10 minutes. So it'll be kind of short and sweet, but it's something new that we're doing this year. In July, we're hoping to bring forth our funding recommendations to the county board. And I'm hopeful that by August, the board will have made a tentative decision on how to take into account those funding recommendations and whether to approve them and how much to grant out. Everything is contingent on the final levy, which isn't set until December. So there's that initial notification, and then there's a few months wait until the final levy is actually set. And then the awards do go out to grantees in the first few months of the next calendar year, in this case, 2024. For those of you who've applied and received funding in the past, there will be a year-end report due April of 2024 on 2023 activities. It is required that you have a completed and approved report before you're eligible to apply again. Something else that we're going to add this year is another opportunity to present those grant reports in a digital format. So having a presentation via Zoom to the review subcommittee is going to become part of the grant reporting process. It's just another way for you all to talk about the work that you do out in the community, and for our review group to get the chance to ask questions and just to have more of an interactive experience. So those two virtual sessions, both the Q&A and the grant report, those are the primary changes to the process this year. Everything else is largely the same. So going over kind of the nuts and bolts, let me see, I see there's some stuff in the chat here. Okay, we're good. So let's see. What happens after you turn in your application? I guess I'll back up and say that the components of the application. We are doing an online application again. It really helped to sort of compare apples to apples, to have everyone use the same format to complete their request. Tips and tricks. I think what the review committee is looking for is clear, concise answers. So there's not a word limit or a character limit, but if you're considering applying, just kind of keep that in the back of your mind. How can I answer this question in a very clear, concise way so that the people on the other end who are reviewing my application know exactly what it is that I'm planning to do with this grant award if I get it. Aside from the online, so there is on our website like a Word document that has all the questions laid out. So I would recommend, opening that Word document, maybe writing your questions in the Word document for reference. When you do the online form, you can't save your work. So it's a good idea to have it all saved in a Word document in case, you have to start and stop, or you want to share your draft with other people in your agency. You can't do that on the electronic form. So, there are some shortcomings with the process, but I think we can get around them by using multiple programs, by using Word and the online form program. We're also asking for the first 2 pages of your 2022 tax returns for your organization, as well as a project budget, and both the copy of your organization's tax returns and that budget, those 2 attachments get sent via email to PHHS. So at the end of this meeting, I will share with you, what we have on our website, because that's where you can find that template budget. That's where you can find that Word copy of all the application questions. That's also where you can find the link to submit your online application. And I'll put that link in the chat when we're done with the PowerPoint. So let's say you've done all of those things, you've sent in your form, you've sent in your email attachments. What happens next? So what happens next is I compile all the materials from all of the applicants and send out a packet to each of the reviewers on our subcommittee. They have some time to review them all. And then we have our Q&A session. So when our review subcommittee members, are writing their notes in the margins, they'll know when they see you on the 7th, oh, I wanted to ask this group about the specific program, or, I did have a question about the budget they submitted. It's just going to be you as a representative of your agency, those 5 members of the review subcommittee. We may have a commissioner sitting in to learn a little bit more about the process, and myself. So you're not going to be in front of all the other applicants. It's really designed to be much more conversational with the review group. Then the review group gets back together a second time. We have a scorecard for those 5 members of the subcommittee to use to kind of score all of the applications. And then we have a discussion based on those scores, any questions or comments the members of that review group have, and we put together funding recommendations for the board to look at. So really my role is kind of that convener, compiling the information, and those members of the review subcommittee are really doing the heavy lifting in terms of assessing the different requests. And then, that's when our director, Allison McIntyre, gets the information to present to the Board of Commissioners for their funding decisions. So I kind of went over what's new, but that is our process. Spring of 2024. Yes, thank you. There's a typo here. The virtual presentation of grant reports from 2023 will be in the spring of 2024. So let's see. Okay, let me see. I've got a lot of screens here. And I think, can everyone see the county's website on their screen now? Okay, I'm going to go ahead and put this in the chat as well. Okay, so this is the direct link to our webpage that has all the information from the Public Health Fund on it. If you lose the link, you can go to the county website and up here in this search bar, just type in grant, and the first thing that comes up is the Public Health Fund grant information. It'll get you right back to this page where we are right now. You can see our kind of historical summary of what agencies have received funding in the past and how much. You can get a link to our current health assessment and health improvement plan. When you're thinking about how your program aligns with these goals, it can be nice to read through this and just kind of see what it is we've set out for ourselves as goals and why. And then down here, this is where all the information that you're going to need is living. So we have a link to our online application. It has has all of what's required of you, has all of the, all of the questions that you need to answer. It'll also bring you to this Word copy of our application where I said you could, kind of use this as a working draft for yourself. Since you can save your work in here. It also has this project budget, which is a template that we ask all of the grantees to use. It basically tells us what it is you're going to use the funding on. How much will go to salary and fringe, how much will go to travel and training. It just goes down kind of area by area and really spells out for us how your request will be divided with the programming that you're hoping to accomplish. And there's room for you to write notes in here as well. I did want to bring to your attention one more thing that is very specific to applicants that are nonprofit childcare entities. So we at the county have a pilot program running for 2023, and it's called the Child Care Wage Enhancement Program. If the board decides to continue funding this program in 2024, then any nonprofit childcare that is looking to use funds for wages or benefits for staff will be asked to go that route versus the Public Health Fund. So if you are a nonprofit childcare organization and you're looking for grant funding to support staff wages and benefits, then what we ask you to do is really spell out in your budget how much of your grant request would go to that area. It's all dependent on what the board does. If they do not continue the wage enhancement program, then your request could be considered for part of the Public Health Fund. If the board does continue this child care wage enhancement program, then your request would need to go through that avenue. And we're very careful that, those entities that are requesting funding for childcare are only accessing funds through one stream. They're not, in other words, like double dipping. So that is something new for this year as well. It really only affects nonprofit childcare entities that are applying. So that is it for my presentation. You can always ask me questions. I have my contact information up here on the last slide. I'll stay and answer questions now, but if you're working on your application and something comes up, don't hesitate to reach back out to me. If I do receive questions via phone or email, we're going to post those to the website too, just so that there's full transparency. If there's another entity that maybe has a similar question, all those will be at that same website with the application materials. So that is all I've got. I'm going to stop sharing my screen in a minute here. We'll also send this PowerPoint to, if you want to put your contact information in the chat, I'll make sure everyone who's attending gets a copy of this PowerPoint. And it's also going to go onto our website, so you will be able to access this information after the fact. All right. Let's see. Jody, I see you have a hand up.
Thanks, Grace. That was super helpful. My question is related to we have to have a 501c3. And I came because I wasn't curious when the grant funds would be actually distributed. And it looks like it will be next year in February. And the early childhood work that I'm doing now is housed at SMC, and we're trying to figure out where we can house us more centrally. And so if I were to put this application through with SMC, and then we're so lucky that we're able to get kind of shifted to a different nonprofit, I'm curious if that poses a problem for this application, or any thoughts. Or should I just not think about this for this year and wait till we have a more solid long-term host?
I would say that if you currently have a fiscal sponsor at Sawtooth Mountain Clinic and they are a nonprofit, go ahead and apply as is. You know, you would, if you shift, it would be to another 501c3. So
correct.
As long as nothing substantial in the proposal changes in terms of the work you would be doing, I think you should go ahead and apply using your current fiscal sponsor, and maybe make a note on your application of where things are at in the process of fiscal sponsorship for your initiative, just so that the review group has a heads up that that's where things stand with your organization or your project.
Great, thank you.
Frank.
I have one question, if you think it's appropriate. I would like the applicants, if they wouldn't mind, just to let us know how they heard about the meeting today. I'm a communications guy, and I just want to know which channels are most effective.
Boreal had a media release. That's how I found out.
Through the newspaper?
Boreal.
Through Boreal, thank you.
I was going to say it was an email I received, but I'm not sure if that was a Boreal. It might have been a Boreal email, or if it was from Public Health. I'm not sure. Allison, Grace.
Email.
Email.
Thank you.
Email. Yep. Email.
And those are all through Boreal? I mean, Boreal give an email blast to? Okay.
Mine was from Public Health because we were a previous.
Okay. Thank you.
Yeah, and if you know of other agencies that you think would, qualify under serving a public health purpose, aligning with some of those priority areas, feel free to spread the word. We will have this posted, like I said, so it's not like if you missed today's presentation, the information's just gone. It will be living on our website as soon as we can get the recording up. So definitely before the end of the week. I don't know if before the end of the day might be a bit ambitious, but that's the plan. So
I'm not telling anybody else.
You want all the money.
I do have one question. Did I hear you correctly that we could save our work on the Word document?
I would recommend that, just because if you're like, let's say you sit down to do your application, you get interrupted, you want to send a draft to maybe your board or a colleague, like the online form just does not make that possible. So you can do that on that Word document that is the kind of Word version of the application, but then the final application does need to go through that online form. So
okay, And there's no limit to the words this year?
You know, my understanding of it was that there is there's a limit to the overall words in the entire application, but it's not question to question. So if you get to the point where you're applying and somehow it cuts you off, go ahead and let me know. Send me an email or call me and just let me know that you're having a technology issue, and we'll work through it. You know, worst comes to worst, we can take the Word application, but like I said, we're just trying to make it easier to kind of compare applicant to applicant by having this standard form for online submissions. But we don't want that to be a barrier. If the technology really isn't working out, go ahead and just let us know and we'll work with you. All right. Thank you all for coming.
Thank you.
Happy.
Yeah, nice to see everyone. It's kind of nice.
Yeah.
We see each other once a year. Thank you. Bye. Thanks,
Thank
Bye,
Grace.
everyone.
And everyone else.
I know. Thanks, Grace.
Thank you.